As men age beyond 50, life brings wisdom, experience, and often, a quieter pace. But along with those gifts come subtle health challenges, ones that rarely announce themselves with loud alarms, yet can change everything if left unchecked. These are the silent threats, the unseen whispers of the body that many men overlook. In this video, we'll uncover the top 10 silent health issues men over 50 often ignore until it's too late. If you or someone you love is over 50, these insights could save a life. Let us begin. 1. High blood pressure, the invisible killer. You can feel completely fine, yet your blood pressure could be high enough to cause a stroke or heart attack. That's the cruel thing about hypertension, it has no symptoms until the damage is done. Most men over 50 assume if they're not dizzy, fatigued, or getting headaches, their blood pressure must be fine. But the reality is, more than half of men over 50 have high blood pressure, often without knowing it. Unchecked, it silently damages your arteries, your kidneys, your heart, and even your brain. It doesn't just raise your risk of heart disease, it affects memory, vision, and your sexual health. What makes it worse? Stress that you tough through without addressing. Salt-heavy diets. Lack of regular medical checkups. Denial, thinking I feel fine, so I must be fine. When should you see a doctor? Even if you feel great, get your blood pressure checked at least once a year. If it's over 130/80, your heart is under stress. Don't ignore it. A silent killer doesn't knock. It just walks in. 2. Prostate enlargement, slow and silent. It starts subtly. You wake up to pee once a night, then twice, then 3 times. You notice a slower stream, or that you can't empty your bladder fully. This is often benign prostatic hyperplasia (BPH), a common but silent condition where the prostate gland enlarges and starts pressing against the urethra. It's not cancer, but left unmanaged, it can cause urinary tract infections, kidney damage, or even incontinence. And yet, most men stay silent. They consider it a normal part of aging and say nothing until they're in pain, or can't urinate at all. Why is it ignored? Embarrassment. Belief that it's just age catching up. Fear of diagnosis. When to act: if you're peeing more often, feeling urgency, or notice a weak flow, get a simple exam. Early detection can lead to simple treatments and prevent complications. 3. Type 2 diabetes, the sugar trap. Diabetes doesn't just hit with sudden symptoms, it creeps in. Slowly. Quietly. By the time most men notice signs like blurred vision, fatigue, or slow healing wounds, the damage is already underway. Men over 50 are especially vulnerable due to slower metabolism, loss of muscle mass, and higher visceral fat. What's at risk? Eyes, diabetic retinopathy. Feet, nerve damage, poor circulation. Kidneys, renal failure. Heart, increased risk of heart attack and stroke. Sexual health, erectile dysfunction is common. Many men live with undiagnosed prediabetes for years, believing their symptoms are just aging. What are the silent signs? Increased thirst. Frequent urination. Feeling tired despite sleep. Dark patches on the skin, neck, elbows. Trouble concentrating. Get a blood sugar test yearly. Especially if you're overweight, have family history, or high blood pressure. Don't wait until your vision goes or you lose sensation in your feet. Diabetes doesn't shout, but it takes everything when ignored. 4. Colorectal cancer, the quietest enemy. Colorectal cancer is one of the deadliest cancers in men, and yet, it's one of the most preventable, if caught early. But the problem is, in its early stages, it makes no noise. No pain. No bleeding. No major discomfort. It hides. Grows. Spreads. Most men don't notice it until it starts causing blood in the stool, weight loss, or changes in bowel habits. And by then, it may have already advanced beyond easy treatment. Why do men ignore it? Embarrassment about colonoscopies. Fear of what the test might find. Misunderstanding symptoms, thinking it's hemorrhoids or something minor. The belief that if there's no pain, there's no danger. But here's the truth: colonoscopy is not just a test, it's a lifesaver. It can detect polyps before they turn into cancer. After age 50, all men should get screened. Earlier if there's family history. And if you notice blood in stool, unexplained fatigue, narrow stools, persistent abdominal discomfort or gas, don't delay. You might think you're just constipated, but your body might be whispering something far more serious. Colorectal cancer doesn't knock loudly. It moves in silently, and by the time it shouts, it may be too late. 5. Sleep apnea, the nighttime strangler. You sleep every night. Or, at least you think you do. But if you're waking up tired, snoring loudly, or if your partner says you stop breathing in your sleep, this could be sleep apnea. And this condition is far more dangerous than most men realize. Sleep apnea deprives your brain of oxygen dozens, sometimes hundreds of times per night. And over time, this leads to high blood pressure, heart disease, stroke, weight gain, brain fog and memory loss, even erectile dysfunction. And yet, most men shrug it off. They laugh at the snoring. They ignore the headaches. They rely on coffee and willpower instead of addressing the root problem. Who's at risk? Men who are overweight, men with thick necks, smokers, men over 50 with declining muscle tone. Silent signs include morning headaches, waking up gasping, daytime sleepiness despite 7 to 8 hours of sleep, mood swings or depression, trouble concentrating. Sleep isn't just rest, it's repair. Without it, your heart, brain, and hormones suffer. If you're over 50 and constantly tired, don't just push through. A sleep study can change your life, maybe even save it. 6. Low testosterone, the quiet decline of vitality. It's easy to dismiss it as just getting older. Lower energy, less drive, lower libido. But behind many of those changes may be a silent, creeping condition: low testosterone, or low T. After 30, testosterone declines about 1% each year. By 50, many men are operating far below optimal levels, but they don't know it. Why does it matter? Because testosterone isn't just about sex. It affects muscle strength, bone density, fat distribution, mental clarity, mood, and motivation. Silent symptoms include irritability or mild depression, loss of confidence, trouble concentrating, fatigue even after rest, increased belly fat, loss of muscle tone. Many men feel like a shadow of their former selves but don't realize there's a biological reason. The stigma is real. Men are taught to push through, to ignore feelings. But low testosterone isn't weakness, it's a medical condition. A simple blood test can reveal the truth. And while not every man needs hormone therapy, lifestyle changes, sleep, diet, and strength training can naturally boost testosterone. Don't accept fading vitality as your fate. You're not less of a man. You might just be low on the fuel that drives your fire. 7. Chronic kidney disease, the silent filter failure. Your kidneys are silent workers. Every day, they filter about 50 gallons of blood, removing toxins, balancing minerals, regulating blood pressure. And yet, when they begin to fail, they rarely make a sound. Chronic kidney disease (CKD) can progress for years without symptoms. By the time you notice fatigue, swelling, or changes in urination, you may have already lost 70 to 80% of kidney function. What causes it? High blood pressure, diabetes, long-term use of certain medications like NSAIDs, dehydration or excessive alcohol. Why men over 50 ignore it? Early signs mimic other aging issues: tiredness, leg swelling, or changes in urination. They don't check kidney function during regular checkups. There's little pain until it's advanced. Key warning signs to notice: foamy or dark urine, trouble sleeping, muscle cramps, swelling in ankles or feet, persistent fatigue. A simple blood and urine test can detect kidney problems early. You can slow or even stop the progression if caught in time. Your kidneys won't complain until they're failing. Don't wait for silence to turn into suffering. 8. Vision loss. Fading sight, fading safety. Vision doesn't always vanish overnight. It fades quietly. Until the road signs are blurry, until reading a label becomes hard, until driving at night feels dangerous. Men over 50 are at risk for 3 major silent vision threats. 1. Glaucoma. Pressure builds in the eye, damaging the optic nerve. It often starts with loss of peripheral vision. 2. Macular degeneration blurs the center of your vision. 3. Diabetic retinopathy caused by uncontrolled blood sugar, damaging eye vessels. Why it's ignored? Gradual changes are hard to detect. Men often don't prioritize eye exams. They think, I just need new glasses, instead of checking for disease. Warning signs include: trouble seeing at night, needing more light to read, seeing halos or blurred central vision, difficulty recognizing faces. What to do? Get a comprehensive dilated eye exam at least every 1 to 2 years. If you have diabetes, yearly exams are a must. Your eyes are irreplaceable. Don't let slow damage steal your vision while you're too busy to notice. 9. Depression in men. The hidden darkness. It doesn't always look like sadness. In men, depression often hides behind silence, anger, irritability, or isolation. It's not always tears. Sometimes, it's withdrawal. From family. From joy. From life. Over 50, men face new emotional challenges: retirement anxiety, loss of identity, health fears, loneliness, grief and loss of peers or purpose. Yet many men never seek help. They believe, I just need to tough it out. It's just a phase. I'm just tired. But depression isn't weakness. It's not failure. It's an illness, and it can be deadly if ignored. Common signs in men: irritability or anger, loss of interest in hobbies or sex, sleep problems, changes in appetite, feeling numb or empty, thoughts of worthlessness, overworking or substance abuse to escape. Why it matters? Untreated depression can increase your risk of heart disease, stroke, dementia, and even suicide. Talk to someone. A friend. A doctor. A therapist. You are not alone. And real strength is asking for help when the world teaches you not to. 10. Heart disease. The ultimate silent threat. It doesn't always come with a dramatic chest pain. Sometimes, your first symptom of heart disease is sudden death. That's why heart disease is still the one killer of men worldwide. And yet, it often develops quietly over decades. Plaque builds in the arteries. Blood flow slows. The heart strains. Until one day, a clot forms, and everything changes. Men over 50 often ignore mild chest discomfort, shortness of breath with light activity, unexplained fatigue, pain in the jaw, shoulder, or arm, indigestion mistaken for heartburn. Other silent signs: erectile dysfunction linked to poor circulation, irregular heartbeat, dizziness. Why men miss it? They think heart attacks are always sudden and obvious. They avoid checkups out of fear. They normalize symptoms as just age. But heart health is not about guessing. A simple EKG, blood tests, and stress tests can reveal a lot before it's too late. Start by knowing your numbers: blood pressure, cholesterol, triglycerides, blood sugar, resting heart rate. And remember, the heart whispers before it screams. Listen. You've just heard the 10 silent health issues men over 50 often ignore. But the real message here isn't about fear, it's about power. The power to pay attention. The power to take action. The power to keep living fully, not just aging passively. Your body speaks, even when it doesn't shout, and ignoring those whispers is not strength. Strength is honoring the life you've built by taking care of the vessel that carries it. So talk to your doctor. Get those checkups. Ask the hard questions. And never, ever, believe that silence means safety. Because the world still needs you. Healthy. Present. Alive. Thanks for watching. Don't forget to subscribe for more timeless wisdom. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Reading your comments give us great motivation and encouragement. If you enjoy this video and found it helpful, please like, subscribe and share. Thank you for spending these moments with us. Stay strong, stay wise.